Olga is Russian, her husband Ukrainian, their family a refuge, their countries at war.
The BBC's Lucy Williamson with that report. Moving away from Ukraine, there are several potentially significant elections this year. Hungary and France could be the ones to watch in the short term, and later on, Brazil, where far-right President Jair Bolsonaro has just held a rally widely seen as the launch of his re-election campaign. Here's Ana Ianova, a journalist based in Rio de Janeiro, on the significance of the rally.
Because we're about 6 months away from the elections, everyone is looking for clues in terms of what direction the candidates will go in. And yesterday's rally was significant because although it can't be called a pre-campaign launch quite yet, since Brazil's electoral rules don't allow campaigning yet, it showed some glimpses of what kind of rhetoric Bolsonaro will be betting on in this run-up to the election, where we're in the context of his support really plummeting. His approval ratings have been battered by his handling of the pandemic and rising poverty, inflation. People are really suffering in Brazil. So things are not looking great for him. He's relied on a lot of similar rhetoric, kind of borrowed from the playbook of Donald Trump in the US. And yesterday, what we saw him doing is kind of doubling down on his claims of anti-corruption, even as his own administration faces allegations over bribes kind of surfaced last week. So he's really kind of digging in his heels in that regard. And of course, he is attacking his biggest rival, former President Lula, who is leading in the polls. So he was betting on this polarizing factor, which really worked for him in 2018. He's hoping that it will come through for him this time again.
It's the moment from the Oscars everyone is talking about, the Will Smith slap, of course. He slapped Chris Rock in the face on stage after the comic made a joke about his wife, Jada Pinkett Smith. Sources say the Academy considered removing Smith from the ceremony but couldn't make the decision fast enough. Moments later, he won the Best Actor Oscar. It has now condemned his actions and is exploring further consequences, but Hollywood and social media are divided. Some are praising Smith for standing up for his wife, while others say he disgraced the community. In the last half hour, Will Smith has posted an apology on Instagram. He says violence in all of its forms is poisonous and destructive. He calls his behaviour unacceptable and inexcusable. He has apologised to Chris Rock directly for the first time, and he's also apologised again to the Academy and to the Williams family and his King Richard family. He calls himself, at the end of the post, a work in progress. Marnie, did you see the moment?
Of course I saw the moment, Paulina. I mean, it broke the internet. It was everywhere.
You couldn't escape it.
You couldn't escape it. And so many interesting takes on it. But what I think it has highlighted, though, is the impact of violence and not trivialising it, because I think the internet can kind of take these things and run with them. But yeah, I think this apology is a little bit too late. And also, as well as the Academy saying that they didn't act fast enough. They've definitely acted faster in previous shows when things have happened.
It's sort of been 24 hours and I'm still waiting for the Academy to do something or say something. But it's been really interesting reading all the different opinions and layered opinions.
Definitely. Oh, hey, thank you, Paulina. That is World Watch, and that is Midday Report for today. We'll be back tomorrow, of course, but for now, kia pai tora. Hei kona.
RNZ News at 1. Good afternoon, I'm Marama Tipole. Anti-poverty groups say increases to benefit rates next month will still leave families trapped in poverty. Modelling by the Fairer Future collaboration shows a couple with 2 children on JobSeeker will face a shortfall of $307 per week compared to the amount of income needed to meet their total costs. A collaboration spokesperson, Max Harris, told Midday Report it's not unrealistic for benefits to meet those costs.
The Welfare Expert Advisory Group reported in 2019 the world has moved on quite a bit since then with COVID, with rising petrol and food costs and other costs, including rising rents. And the government's signed up to documents that say they're committed to an adequate standard of living.
Max Harris says some whānau are being forced to choose between paying the rent or putting food on the table or getting into debt. And news just at hand, RNZ understands Labour MP Louisa Wall is set to resign from
case numbers, and then show you some slides which demonstrate where we are in the outbreak and what we can expect next. So today there are 17,148 cases being reported. There are 842 people in hospital and 26 people receiving ICU level care. That is down on last week's peak of 33 people in ICU and 1,016 people in hospital last Monday and Tuesday respectively. Today we are sadly reporting the deaths of 34 people with COVID-19, taking our 7-day rolling average of reported deaths to 15. These deaths take the total number of publicly reported deaths with COVID-19 to 303. Sadly, this is not unexpected, and overseas experience shows us the deaths of people with COVID-19, including Omicron, lag reported community cases and hospitalizations. The deaths reported today have occurred over the past 10 days. Delays to reporting can be associated with people dying with rather than of COVID-19, and COVID being discovered after they have died. We expect the number of deaths reported will continue to fluctuate day to day, but the 7-day rolling average to remain at similar levels for the coming weeks. Evidence to date suggests some of these deaths will not be caused directly by COVID-19. However, we are seeing many people who are dying with COVID-19 who are older and may have other pre-existing conditions that heighten their risk from infection. Of the 34 deaths reported today, 27 were over the age of 70. Our thoughts are with all of their whānau and friends at this time. Despite today's high number of deaths, it is encouraging to see a continued and sustained drop in overall case numbers. For 3 days last week, case numbers were reported at over 20,000 cases. That reduced to 14,175 on Saturday, continued to decline to 10,239 on Sunday, and then 12,882 yesterday. Today's case number is up a bit, but that's to be expected, as testing rates are always a bit lower on the weekend, and we do tend to see a bit of a Tuesday surge. The reduction in case numbers has been most pronounced in Auckland, where reported case numbers have fallen steadily from just under 4,300 reported cases last Monday, compared with 2,300 reported yesterday. The 7-day rolling average of reported cases, again reported yesterday as 16,102, provides a useful guide to the trend in case numbers. This time last week it was 17,124, so we're seeing that continuing drop. While numbers overall and in Auckland are dropping, we are still seeing spikes regionally. This again is not unexpected and can be explained by the stages that different regions are in with their peak. For example, case numbers in the Wellington region were 1,592 yesterday, compared with 2,508 a week ago. So the so-called Mexican wave of cases, we're currently seeing that reflected most in Canterbury, for example. The latest reported case numbers from yesterday show Canterbury and South Canterbury combined have a higher number of cases than the Auckland region. So we're seeing those numbers roll down the country. And the 7-day rolling average for Canterbury is 2,627. This time last week it was less than that, it was 2,453. So we're seeing these various patterns across the country. Now, Canterbury District Health Board does report that their hospitals are busy, but they're coping. This morning, Christchurch Hospital has 510 patients and 63 are COVID positive. Across Canterbury, hospitals are caring for a total of 74 people with COVID. Hospitalizations are expected to increase 7 to 10 days post-peak, so we would expect hospitalizations in Canterbury to be increasing there this week. Our message continues to be that our best protection is to be up to date with COVID vaccinations and boosters, along with the other precautions of staying home when sick, get tested when you have symptoms, and wear masks as directed. There are 1 million New Zealanders who need their third dose or booster. We know that your chances of being hospitalised if you're unvaccinated are 5 times higher than vaccinated. So if you've had your first 2 doses, please don't stumble at this next hurdle. The evidence shows a booster or third dose can stop you becoming infected in the first place and stop you becoming more seriously ill if you are. If we just turn to the screen now to show some slides. Can I have the first slide up, please? So the first slide. So this first slide, just to give you a picture of some of those numbers that I've been throwing out at you earlier on. This is the new cases reported for Auckland Metro. And while the numbers bounce around a bit, you can see that there's a very distinctive peak and that the Auckland numbers have fallen down, and we are now back to the levels that we were at in mid-February. If we go to the next slide. By contrast, these are the cases outside Auckland, and you can see there's still a bit of fluctuation day to day for the numbers, but it's less obvious, the decline in case numbers. We do get the spike that happens on a Tuesday, so we're keeping a close eye on what the numbers will be for the rest of this week, but we do expect this trend that was seen last week of the numbers gradually coming down. We expect that to be the situation this week. The only DHBs to report an increase in cases are the South Island District Health Boards, along with Taranaki, Mid-Central and Wanganui. So that probably tells us that the rest of New Zealand is about a couple of weeks behind Auckland, and it gives us a signal of where we hope to be in the next 2 weeks. If we then move to the next slide, this slide shows hospital admissions, and this is for the Northern Region hospitalizations. And as you can see, the blue columns there, this is against a background of different modelled scenarios. You can see that those blue lines are coming down, and that shows that the number of hospitalizations in the Northern Region have come down. I think there's quite a clear pattern there. And the district health boards, whilst those hospitalizations are coming down, they're still reporting that there's pressure on their services, but that is easing. And then if we go to the last slide, please. This shows the hospitalizations for the Auckland region, which is the darker blue colour at the bottom, compared with the rest of New Zealand. And the pattern there is that the hospitalizations outside Auckland have remained fairly static in the last week. So the impact when we report the numbers dropping for hospitalizations, it's predominantly the Auckland effect that is driving that. But in the same way that we've seen with the case numbers, we are optimistic that in the next few weeks the rest of the country will follow the same pattern as Auckland, and we'll see that drop in hospitalisation and that decrease in pressure on our hospital services. And finally, thank you. And finally, I'd like to finish with a couple of reminders about things that we often get asked about. One is, when does the 7-day isolation period for new cases begin? So day 0 is either when you first test positive or the day that your symptoms first begin, whichever of those dates comes first. And you need to isolate for 7 full days from that point. Just a reminder, if you are still sick at the end of the 7 days, please stay home until you are well and for 24 hours after your symptoms have gone. The second thing we often get asked about is whether you need a negative test to leave isolation. As a case, you do not. And that's because many people with COVID-19 can continue to test positive for some weeks after their illness and long after their infectious period has finished. In fact, you should not have further COVID-19 tests for 28 days from when your symptoms started or when you tested positive, whichever came first. However, after 28 days, if you get new symptoms, take a rat test. If it is positive, you would be considered to be a new case. You will need to re-isolate and follow the guidance for people who have COVID-19. So while you can get COVID-19 again, you can get reinfected. We're saying for that 28-day period that you're not going to get reinfected. Actually, over the next 3 months, the chances of you getting reinfected is very low. Some people, however, though, might have a PCR test in the 3 months following recovery, and that can actually still show a positive result, even if you do not have a new infection, because the PCR test is a very sensitive type of test, and you might still have the virus in your system. So if that happens and you need a PCR test for any reason, this is when you have been a case, and further down the track you need a PCR test for any reason, during that 3-month period after your onset of symptoms or your first positive result, please talk to your doctor about either getting a medical exemption or consideration of some different types of testing. We know, speaking about the vaccine, we know that vaccine effectiveness for Omicron declines after the second dose, but a booster restores it to about 90%. So please book in for that booster now. However, if you've had COVID-19, you should wait 3 months before getting a COVID vaccination. You can get infected even if you've had your dose 1 and dose 2. And what the infection does is it does boost your immune system. But if you then get your booster dose after 3 months, you get a super boost to your immune response. And so we are advising people, even if you've had infection, that you wait for that 3-month period and then go and get your booster. And finally, a reminder from our colleagues working in hospitals, particularly in the Auckland metro area, that if you have an appointment, please attend that unless you are told otherwise. If for some reason your appointment has been cancelled, you will have been contacted. But if you haven't been contacted, please turn up for your appointment. It has been necessary for hospitals to postpone some appointments and procedures, but some planned care is continuing during this time. And now I'd like to hand over to Dr Joe Bourne. Thank you, Joe.
Kia ora koutou. Thank you for the opportunity to talk about COVID care in the community today. First of all, just acknowledging that we continue to see a very high rate of contact with general practices and other primary care providers wherever there are increased numbers of people with COVID in the community. So that does put significant pressure on the system when we see those high numbers of cases. And I just want to acknowledge the mahi that is involved in providing the care that people need. Many people will only get a notification that comes as an automatic text message that provides them with instructions on how to fill out a form that lets us know how unwell they might be and how at risk they are of having any complications from their COVID infection. And then other people may get a personalised text message that comes from their general practice, who will have undertaken a risk assessment to see the likelihood of them having poorer outcomes while they've got COVID. And then another group who are perhaps at higher risk may receive a phone call. So once again, what we're really encouraging general practice and other kaupapa Māori and Pacific providers to do is focus their resources on those people who are at greatest risk of poorer outcomes when infected with COVID. And we really appreciate the public's help in enabling us to do that by making sure that they flag to us when they think they're becoming more unwell. So we trust people to flag to us when they're getting more unwell, and then we will have the capacity to be able to respond to your needs. Just a couple of examples of where our COVID care in the community programme is working well and how we're enabling local communities to look after themselves. In Tairāwhiti, we've seen an amazing response to not only rising numbers of COVID cases within the community, but also the challenge of the flooding that's come with the recent storms. And actually some of those small teams where you've got people who are working across both the COVID response and the emergency response to the flooding has really helped those providers work hand in hand together to provide for their communities. So in some of the more remote areas of Tairāwhiti, we're seeing welfare providers assisting with the medical assessments and then the providing of medication for people who would otherwise have struggled to access those services. So a good example of how those systems are working well. We're also seeing in the West Coast and South Island how strong community connections are ensuring people that can safely isolate. A woman recently who became a household contact along with her whānau she had no access to a phone, but she was able to signal to the local services via email that she was isolating with her whānau. And then the Care Coordination Hub reached out to a local kaupapa Māori provider who was able to deliver kai and also assess what her medications were because she had some chronic medical conditions and ensure that she had enough of those medications for the duration of her isolation. With the Easter holidays and the school holidays coming up, we just ask people to consider what plans they need to make if travelling away from home. If people, we absolutely understand, particularly after the time that we're going through, that it is really important for people from a wellbeing perspective to be able to reconnect with whānau and to take time off to visit other places in the country. And what we ask is that people consider what planning they need to make should they contract COVID while they're away from home. Anyone that is travelling in their own car is encouraged to be able to go home if you contract COVID, but it's important that whilst travelling home you are maintaining social distancing and using contactless options when it comes to filling your car or getting food, etc. while you're on your way home. For those people that have to use public transport, they're flying or using a ferry, we'll be asking people to isolate where you're staying. So it's important that you plan ahead and consider what the implications would be of having to isolate where you've been staying. What does that mean in terms of your accommodation? How you would then rebook flights or ferries to get you home once the isolation is completed, and what arrangements you might need to make for any pets that you've left behind. So encouraging people to travel and doing what's right for you and your whānau, but also making sure that you have a good plan in place so that should you contract COVID while you're away, you're able to still continue to safely isolate, protecting yourself, but also the communities around you. Just touching upon the use of general practice, and as I've indicated before, we are seeing increased contact with general practice during this time. We're going to have 2 shorter working weeks with the public holidays around Easter. So we're asking people to think ahead for things such as repeat prescriptions and ensuring if you anticipate running out of prescriptions during that period, ordering them nice and early in advance to make sure you're not having to ask for urgent prescriptions. And this will help both general practice and our community pharmacies to ensure that you have what you need. Another request that we have from primary care practitioners is to ask people to only ask for medical certificates after COVID infection where really necessary, where you've had to isolate a lot as a standard period of time, and where you've received a text message that says that you have completed your isolation. We're asking businesses and individuals to use that as proof of the fact that you've had COVID and have had to be off work. What we don't want to do is have general practitioners and their practice nurses spending time writing out medical certificates for people who are essentially now well. We acknowledge that interactions with general practice are different than they are at other times, and many general practices are continuing to use their car parks and outside spaces as a waiting room. All of this is about how we protect the people that are using those services, many of whom may be more vulnerable to COVID infection than other people in the community because they have other medical conditions. That means that you will find that general practice staff will continue to reinforce the importance of the use of masks indoors and also hand sanitising. Now, we ask that people just respect those wishes and respect the staff who are purely trying to protect not only the staff within the clinic, but also those more vulnerable people who will be in that clinic environment. Looking beyond Easter, we're now thinking, and general practice is starting to go through this planning of how we can start doing the valuable work that happens in the primary care sector every day. So we'll be encouraging people to start reconnecting with general practices and utilising the services as you would prior to this pandemic. So encouraging people who are due a mammogram or a cervical smear to get in touch. If you have a long-term condition such as heart failure or type 2 diabetes, engage with your practice to ensure that you're getting all the necessary checks done so that those conditions are managed as well as possible. And if you have tamariki and children who are due their childhood immunisations, really reinforcing the importance of keeping up to date with those immunisations, particularly as we come to the time where we're reopening our borders. And lastly, we'll be working across primary care, particularly with community pharmacy, to ensure that everybody who needs to have a flu vaccination will be able to get that as easily as possible. So thank you again for the time, and I'll hand back to Dr McElnay.
Thanks, Dr Bourne. We're happy to take questions now.
Dr McElnay, just on the likely increase of infectious diseases that will probably come into New Zealand once the borders open, how concerned are you about that? And actually, just following that point from Dr Bourne, what's, apart from the MMR campaign, what plans are in place across the country to lift child immunisation rates which have dropped during the pandemic?
So I might just touch on the childhood immunisation rates firstly. We are very concerned about that, and we have a task force that's been put together at the Ministry to advise on what needs to happen to get those rates back up. That is something that has been seen in other countries and has been one of the unintended outcomes of lockdowns and the impact on services, but it's certainly something that we are very concerned about at the Ministry, and we do want to see those rates up, and particularly for Māori, we want to get back to the rates that we had some years ago, where there was no difference in childhood immunisation rates. And in keeping with that, one of the particular vaccines that we are concerned about is MMR, because that is the best protection against measles, and we know that we had a measles outbreak before COVID 3 years ago, and we saw the impact of that, and we've seen the impact of measles overseas. So again, we need to get our MMR rates back up for our children who are due it at the 12 months and 15 months, but also we need to do a catch-up, which in this situation is not just for the last 2 to 3 years, it's actually with all those young adults who we know aren't protected against measles. So we are, we're taking that very seriously. We are very aware that that as we continue to open the borders, that measles in particular is something that we don't have in New Zealand. It only ever comes into New Zealand across the border. So we need to be prepared and as protected as we can be for that. The other area, of course, is flu. And as Dr Bourne said, the flu campaign kicks off at the end of this week, and it's really important that people do get their flu vaccine. Again, flu is something that we do traditionally see coming in across our border. And we've been closely monitoring what's been happening with flu overseas. On the plus side, it doesn't seem at this point in time that there's been a huge amount of flu. The UK didn't have a lot of flu, but that's absolutely no guarantee that we won't see in the southern hemisphere an increase in flu. So again, it's about vaccination to make sure that you're protected. And some of the other illnesses or infections that happen across the border, some of those we can't actually vaccinate against, and we're looking to see how we can have early warning systems to just make sure that we continue to make sure that the health of New Zealanders is as maximum as it can be. Sorry.
Why is it so low? What's
Sorry.
the reasonings behind childhood immunisation?
With childhood immunisations, it's been they were declining. We were seeing a pattern of decline before COVID, and some of that is related to the timing of some of the vaccines. So we saw the uptake was different at different times, different periods when vaccinations are due. But it was a pattern that we had seen before COVID, and then with COVID and with the effect of that, and also families keeping children at home and not wanting to go out and see the GP, we've continued to see that decline in our rates. We don't fully understand why that decline has happened. It is something that we have seen in other parts of the world. But despite that, we know that we need to get those rates back up, and that's what the focus will be, is on making sure that we do everything that we can to get those rates back up, because that is a fundamental part of our public health protection, is high childhood vaccination rates, regardless.
What is the Ministry of Health?
Sorry.
Just off the back of Anna's question, how could the health system actually cope with the pandemic and a potential measles outbreak and dealing with coming into winter, other illnesses, including the flu? How much pressure would that put on the system?
Well, it certainly would put pressure, will put added strain onto the system, and we're doing everything that we can to make sure that we're not in that situation. And so that does mean that we need to continue to vaccinate with COVID. We are seeing the effect of vaccination with COVID, particularly in the reduction in severe disease. We need to get people once the flu vaccine's available, we really encourage people to get vaccinated against flu, and we need to get our immunisation rates up for children, particularly the measles and the MMR.
What's the Ministry of Health's response to the petition that's been created and has hit over 12,000 signatures, asking for acknowledgement of harm caused by the COVID-19 vaccines and a need for medical support? Is more support needed for people medically affected by the COVID-19 vaccine?
Well, the Ministry of Health has a monitoring system for vaccine safety, and we get regular reports on vaccine safety. There are every case of harm that has been reported is investigated and is fully investigated. I'm not aware of the particular petition that you're talking about, but I do know that when you look at the number of vaccines that have been given, the COVID vaccine that have been given, there's a very small number of reports that are concluded by our independent safety monitoring board that could be related to the vaccine. I mean, vaccines are medicines, and so you can get unintended consequences from the vaccines, but it's a very small number, just to put it in context. And we do look in detail at those incidents, and then at the support that families and people who've been affected, the small number who've been affected, what can be put in place to support them.
For that small number, we spoke to a couple of people today who are handing over the petition who claim they've been injured by the vaccine. Do you have a message to them? They feel as though they've been ignored throughout this pandemic and haven't had adequate support from their injury. What's your message?
Well, certainly the Ministry of Health does not intend to ignore anyone who feels that they've suffered harm as a result of the vaccine. It is important that is lodged, that we have systems and processes in place to investigate that, and that there are support services in place for people who may have been affected.
Do you have a number of people who have been affected or injured by it?
I don't have a specific number here. I do know that for some other aspects that we've been monitoring, that there's a very small number in the greater, when you look at it in the context of the number of vaccines that have been given, and we regularly compare. We regularly review that data. We have very good reporting in New Zealand of any adverse events as a result of a vaccine, and we regularly review that data. We compare ourselves with other parts of the world, and we are certain that that the COVID vaccine is safe, it is effective, but we do encourage people who feel that they may have been harmed to discuss that with their doctor and to make sure that those reports are getting through, because it's through the reporting of that then we can deal with the issue. Thank you.
Just on the 34 deaths, are you able to give any more details, like people's ethnic background and where in New Zealand they were? And does that sort of relate at all to the drop of people in ICU? Or are people sort of dying in ICU or home isolation?
I think in the up on the website later today there'll be the details that we usually provide. I don't have those in my talking points today. I did refer to their age, where of the 34, 27 were over the age of 70. And that certainly is consistent with what we have been seeing, and whilst every I want to acknowledge every death is sadness and a loss to whānau and friends, we are seeing it in those older age groups, and that is a reminder that actually whilst for many people Omicron can be a very mild and for some people completely asymptomatic with Omicron, there are a number of people in the community who may be severely unwell and may sadly die, even though we don't know that all of those 34 will actually have died because of COVID. It's important that we keep track of the numbers and that we investigate fully to find out what more we need to do in order to protect people.
There's another petition.
Yes, sorry.
On long COVID and the fact that little data is being gathered in New Zealand, would we look at anything along the lines of what the UK is doing with sort of a self-reporting scheme?
I might ask Joe if he's got any comments on this. I thought that we were actually setting up a system to be able to have more New Zealand information about long COVID. Joe, that might be something that, from a primary care perspective, you've got a few more observations on it?
Yeah, I think as we've seen increased numbers of COVID across the country, and certainly in my practice, I'm starting to see a few more people who are coming in a couple of weeks after the end of their isolation, maybe with a continuing cough or some other symptoms. I think it's important to note that the vast majority of these symptoms are gone in that sort of 4 to 6 week period. So when people start to describe the multiple symptoms associated with what's being known as long COVID, the sort of prolonged fatigue, the numbers who are getting that is far, far smaller. And it is quite consistent with other viral infections that people get, a sort of a post-viral syndrome where people can feel fatigue and a range of other symptoms beyond the actual acute infection. The Ministry of Health is currently working with allied health teams in particular to undertake some study into what sort of interventions will help people to make a full recovery from COVID, and those discussions are ongoing to ensure that we can meet the needs of those, like I say, a relatively small bunch of people, but a significant bunch who will need more assistance beyond their acute infection.
Thanks, John.
There's also been another petition recently just calling for more people allowed into birthing suites, or more than one. Can I just have some clarification on that? Is that different across different DHBs under RED? Do you know like the support people limit?
It's not specifically a requirement under the RED setting, and that's where the different district health boards will be putting in place their own set of rules and guidelines for how they manage the wide number of different patients, and that will include in the birthing units. So there may well be different practice happening in different district health boards, but it will be based on how their particular birthing unit operates, the flow of patients through that, but it's predominantly there to keep patients safe as well as helping to protect staff as well from infection.
Where is that balance between, on the outside there's mandates dropping, gathering limits increasing, but there's also more of a COVID risk in hospitals. Where do people who are about to, or who are giving birth, really sit in the scheme of things? If they want more people, should they be able to have more than one person sit on the birth?
I think that's where it's very difficult to generalise, and I'd really encourage pregnant people to talk to their lead maternity carer around what are the local arrangements. We have seen throughout our 2 years of COVID response, our restrictions have changed throughout that time. We're currently in a situation now where we have very high vaccination rates. Our population level restrictions are continuing to decrease, and so without getting into the specifics, I think people in that situation do need to talk to their maternity carer and find out what the local situation will be for them. We constantly are trying to balance infection risk versus actually enabling people to live their lives and be part of society and be able to do the things that add value and meaning to them. But it is a constant balancing act.
Just a question on sort of deferred or sort of postponed hospital care. There's a lot of staffing shortages and things like that. Do you have any idea of how the scale of that at the moment and sort of how it compares to previous sort of lockdowns and things like that?
I don't have any information as to how it compares to previous lockdowns. I suspect that it's less than previous lockdowns. It's certainly the very first lockdown that we had, because what we have encouraged district health boards to do is to keep planned care going for as long as possible. And it's really when workforce issues have struck that hospitals haven't, particularly hospitals, they really have had to scale back some of the planned care in order to address the fact that they've got staff who have been affected with Omicron. And it does vary throughout the country. What we're seeing, what we saw first, it was really the Auckland hospitals in particular. And my apologies for just talking about hospital. I might turn to Joe and talk about get him to talk about primary care. But certainly what we've seen is impact was greatest in Auckland first, and now we're seeing Canterbury, who are having that problem. But I've spoken to senior officials in Christchurch today, and they've assured me that they're dealing with it. The system is stretched, but they've had to defer a few things. But hopefully they'll get through that by the end of the week and then be able to ramp up again. Joe, did you want to say anything in particular about primary care and the planned care or the impact on work because of the workforce?
Yeah, I guess I was alluding to that when I was talking about what we're expecting to see after Easter, where whilst we may still see significant numbers of COVID cases, it will become more normal within our community, and then we do have to start reprioritising our efforts to make sure that we look after other chronic diseases which also have a significant impact on people's health. So it's right to say, particularly if you think about it in the general practice context, a smaller workforce to start with, so it doesn't take many people off to have a significant impact. But general practice has been working in very different ways for the past 2 years, an increased number of phone consultations and working out ways of communicating with people on email and other patient portals so we can continue to provide that necessary care. We'll probably also start looking ahead to the success of New Zealand's response to the COVID pandemic has certainly increased a lot of interest overseas in healthcare professionals who are looking towards us as a good place to come and work. And we're starting to see a number of people making inquiries. So whilst it's ideal that we will continue to grow our own workforce, we should be able to supplement that with people coming from overseas, which will definitely help as we move forward.
Thanks, John.
Follow-on question for that, probably again for Dr. Bourne. You used mammograms and smear tests as an example of when after Easter you want
sort of general practice to resume, how many people do you think are behind on getting mammograms and smears at the moment?
Sorry, I can't give that information today, but I know that the primary care teams are working on developing those dashboards so we can see where the numbers are at the moment. But I think it's fair to say that there has been less engagement with general practice for other reasons over the past couple of years, and so people haven't prioritised getting their mammograms or their cervical smears in the same way as they have done before. What I have seen is where general practice is able to refocus on those activities, and I certainly have some examples of where they've already started refocusing on childhood immunisations. Some of those trusted relationships that have built up over the last couple of years have actually helped us to re-engage with whānau and bring them in. So those immunisation rates do start to rise quite quickly. But I know that we will be getting more visibility on exactly where we are with cervical smears and mammograms over the coming weeks.
Dr McElnay, when are we expecting to see the reporting from the Cancer Control Agency on how the current COVID-19 outbreak has impacted cancer treatment and diagnostics?
I'm not sure of the timeline for that, so we'll get back to you with that specific information.
Do you have an idea on how the current outbreak has affected cancer treatment and diagnostics?
It's possibly too early in the current outbreak for that information to have been collated and analysed, but I know that they will be doing it, so we'll be able to give you an update on when they'll be able to report. I mean, I think, as I said earlier, one of the things that we are seeing with this outbreak is because of the because of the high vaccination rates and because of the protections that we have in place, we've been able to keep services running as much as possible, and it's really been as the Omicron wave has affected different district health boards. It's really the workforce has been the major issue behind not being able to provide care. And what we're seeing, if you look at Auckland, is that's been a relatively short-lived effect. So my hope and expectation is that we would not then see a significant impact on some of the other planned care, or that if there has been, we'll be able to catch it up really quickly.
Where's the Minister of Health at with collating that advice around the fourth dose for immunocompromised and healthcare workers?
Yes, I think as the Director General mentioned last week, specific advice has been requested from our technical advisory group on whether or not we should offer a fourth dose. You'll be aware that some other countries are doing that, so my understanding is that he should receive that advice soon.
With the advice of getting infected with COVID-19 and leaving a 3-month gap before getting a second jab or booster,
yes.
Can you kind of explain why that advice is and what the consequences could be if you were to get jabbed 3 months
Sooner.
or earlier
Sooner.
before or after getting COVID?
That's advice that we have sought again from our vaccine technical advisory group. There are a range of different periods that across the world that different jurisdictions have taken. We ourselves in the past used 1 month as the period after infection before you have a dose of vaccine. Our advisory group has advised us to go with 3 months as a simple message. However, within that, if there are people who, because of their job or particular reasons, need to have that third dose or second dose, that they talk to their medical practitioner that it can be given earlier than the 3 months. So the 3 months is just a precaution. You've already got a boost to your immune system from infection. For some people, getting a vaccine a little bit earlier might just give you a few more sort of reactions at the time of the vaccine. That's just a sign that your immune system is responding. So we've landed on 3 months as a recommendation. Yeah. All right, and if there's no further questions, we might. Oh. I'm not sure how to answer that. It's not really the centre of the outbreak. I'm just thinking what Christchurch what the Christchurch response to that would be. It's not the centre of the outbreak. We're certainly seeing lots of cases elsewhere in the country, but certainly in terms of a spike or a peak, we're certainly seeing a peak in Christchurch at the moment. But as I said earlier, we're expecting that to also get over. It's been generally moving down the country. Yeah, so thanks very much, everyone. Thank you.
Thank you.